is an active threat in some of our local nursing homes during this pandemic, and the problem is magnified at Bakersfield's Kingston Healthcare Center, where the coronavirus is spreading and out of control. Health officials describe it as the epicenter of the COVID-19 outbreak here in Kern County. 19 residents have died. 112 others have tested positive for the virus. So the question is, was enough done to prevent this? It turns out there's been problems there before, and it sounds like things already were bad before the COVID-19 pandemic. 17 News in depth tonight. Here's Alex Fisher.
It's a home with a lot of trouble.
For me, it's been hell on the earth.
Even before COVID, Kingston Healthcare Center was the worst rated skilled nursing facility in Kern County. Its overall score from Medicare is so low, a rating of much below average is too generous. When comparing other nursing facilities in Kern County on Medicare's website, Kingston is the only one with 2 visible warnings. One warns of elder abuse. The other warns of a history of poor conditions.
Oh, it's awful here, Alex. I don't feel good at all. I feel like I'm trapped.
Jennifer Myers is 86. She's been living at the Kingston nursing facility for 2.5 years. She says the conditions are dire, and now she's tested positive for coronavirus.
Yeah, I was a nice person. I was a Christian when I came here. But I just slowly, because I couldn't get anything done at all by being nice, I got to start losing my temper, losing self-control. And I have turned into an angry person. This place can make anybody angry.
There are 19 skilled nursing facilities in Kern. Kingston has 184 beds, making it the largest nursing facility in the county.
We are concerned about the residents.
When the threat of coronavirus was looming, our county public health officials met with all local nursing homes in March to prepare them for the severe impacts. The fear was if the virus got into a facility, it could overwhelm the local healthcare system. Kern health officials say they reviewed protocols put in place to ensure safety. In late April, the county health department reached out to all facilities to provide recommendations on how to control the virus. By late April, the virus was rampant at Kingston. People were dying.
That was the last person we talked to.
That's Angelica Uriarte. Her grandfather lived at Kingston. He was one of the residents diagnosed with coronavirus. He died May 24th.
It destroyed me.
Kingston Healthcare Facility is owned by Dr. David Silver. His resume is impressive. He's an associate clinical professor of medicine at UCLA and previously worked at Cedars-Sinai Medical Center. For more than 2 weeks, we tried calling and emailing. We reached out to him and his team at Rockport Healthcare Services.
I've been trying to reach out to him for about 2 weeks now. Is there any way that you can give him a call again?
I can send them the information.
We never received a response.
Management did not react quickly enough.
It was chaos inside the facility as the virus spread. Local health officials pleaded for immediate relief.
We have scrambled and we have found staff that will assist, and we then have gone to the state and asked the state for help.
The facility is regulated by the state, not the county. For more than 2 months, local healthcare officials have frantically tried to stop the outbreak inside the home. But Kingston has not been consistent with its numbers, creating mass confusion for health officials.
These are people, these aren't numbers. And it's important for us to recognize that it is the obligation of Kingston to not only care for our most vulnerable population, but also to give us accurate data.
The California Department of Public Health regulates the facility. We asked for an interview, but the department refused. In an email, they said state health investigators respond to any complaint of immediate jeopardy at nursing facilities. The department confirms it is focusing its attention on nursing facilities across the state as the pandemic wreaks havoc on these homes.
I would have liked to have seen the state of California deploy more resources, put an army of people out throughout the state in the earlier days of this pandemic that they had the appropriate PPE, that they had the appropriate hygiene controls and monitoring, and that testing was being done. That should have been done in the early days of this pandemic, and I'm frustrated by that.
This virus has shown that there are areas that need improvement, significant improvement.
Kingston is one of those facilities that needed help. The California Department of Public Health sent workers on May 5th. Since then, more than 40 healthcare workers helped with the shortage. But the people working there didn't have much to work with. Local health officials provided the facility with personal protective equipment, far more than any other facility in Kern. We wanted to know how much. Through public records, we found our county health department provided Kingston with nearly 10,000 masks, more than 1,000 gowns, nearly 700 bottles of hand sanitizer, 200 face shields, and 10 boxes of gloves. The problems with the facility go far before coronavirus. Years of abuse has been reported. Kingston Healthcare's website says the facility focuses on the unique needs of the residents and ensures they have a safe, clean, and comfortable environment. But public records show otherwise. We found the facility's last health inspection. In it, alarming failures. The inspection was done in November. The health department found 39 health deficiencies inside the home. The state's average, 13. The report highlights areas of concern, putting elderly residents at risk.
They do not pay attention to you, although their motto is residents first.
Nursing homes are for people who need care by medical professionals. Prices greatly vary and depend on a variety of factors, such as how much care someone would need. At Kingston, the residents I spoke with say they pay about $200 a day. Now, at a time of extreme concern, Kingston appears to be in disarray, and the troubles are far from over as the virus continues to spread.
It's not enough. We need to do more.
And I honestly, I feel for the ones in there. I honestly do. If I could save them all, I would right now.
17's Alex Fisher reporting, and you may recall Alex was the first to break the news of more than a dozen residents at Kingston diagnosed with coronavirus weeks ago. Since then, we have extensively reported on the facility. For all of our coverage, and if you'd like to review tonight's report again, visit our website, kget.com. Just search for Kingston.